My cancer has become micrometastatic. So now what? Stay tuned. It's a thrilling episode of this online cancer diary that I was scheduled to undergo a PSMA PET scan on March 17th. Prostate-specific membrane antigen positron emission tomography. What's that? The docs inject you with something radioactive. The radioactive substance finds cancer cells, attaches to them, and then lights up on a screen, and your doctors can see where your cancer is. No lighting. The drug couldn't find my cancer. But it's clear I do have cancer. My PSA, a prostate-specific antigen, a protein that prostate makes, is on the rise. And I haven't had prostate since July 1, 2020. Now, it's still low by most standards, 0.019, but a year ago it was 0.0008. And there's a problem with the PET scanner and that low of a prostate-specific antigen PSA reading. That is, typically most docs think that the fancy PET scan becomes useful, that is, can identify cancer tumors at 0.02. So I may have undergone the scan a little early. So as my doc says, I have micrometastatic prostate cancer. Metastasis? Well, micrometastases are small collections of cancer cells that have been shed from a cancerous tumor and have spread to another part of the body through the blood or lymph nodes. Micrometastases can then form a second tumor that's too small to be seen on imaging tests such as a mammogram or MRI or PSMA PET scan. It can only be seen through a microscope, hence the name micrometastases. This had given me permission to wait to make a decision on any kind of treatment until June. My oncologist recommended treatment would be hormone therapy, otherwise known by the charming name chemical castration. In the meantime, I'm going to undergo a monthly PSA test. Now, what happens in June? Why wait to June? The Unbound Gravel Race, 200 miles up and down hills, 10,000 feet of climbing on dirt, gravel, and mud. Take it on a slightly different view. Sure, it's good news that the PSMA PET scan didn't find anything, but that rising PSA level indicates biochemical recurrence. That is, my cancer is on the move, on the rise, growing and spreading. Given this scenario, says the German oncology team, DCV, dendritic cell vaccine, is strongly recommended as it has the potential to stabilize the disease, induce a durable remission, and crucially prevent the formation of metastases. Early anti-cancer vaccination at this stage may significantly enhance long-term outcomes and improve disease control. Dendritic cell vaccination from the prior episode. That is a form of immunotherapy. And the way it works is physicians take your blood out of your body, then separate out two kinds of cells. The T cells, those are the cells that attack nasty things that enter your body, including cancer cells, and dendritic cells. Dendritic cells assist the T cells in attacking cancer and other harmful substances in the body. What the vaccination does is, by submitting proteins, enriching the dendritic cells with proteins, makes the dendritic cells more effective in helping the T cells to attack the cancer. So blood comes out, docs mix it up, train it with these extra proteins for about a week, which I'll spend probably bicycling and then stopping off at beer gardens, and then I get injected back into my body. Works better in Germany because it's fresh blood in the United States, as I explained briefly in the last episode. These are done in two separate places. Blood's taken from the patient, sent to one of a few labs in frozen form. The labs do this magic training of the dendritic cells, freeze it, send it back, and early data suggests that it's just not as effective if you have to thaw it out with a microwave or whatever twice, or even once. What do? I train, of course. Now, it's not clear I'm going to be ready for the world's hardest race in 2 months. I lost most of January and February to illness, couldn't cycle at all. I had a respiratory infection that did not play well with my cancer, and I was sufficiently sick that walking up a single flight of stairs would leave me panicked and out of breath. I visited some emergency care centers. I was still having trouble until a couple of weeks ago when a pulmonologist hooked me up with some good medication, and I'm back on my bicycle. Pedaled about 175 miles last week. Longest ride was 60 miles on gravel, and I've got a lot of training to do. We'll see if I can get back to it. The question now is whether I can remain healthy and whether I can train sufficiently for that Unbound Gravel Race, known as the world's hardest one-day bike race. But I'm out there pedaling and doing my best on what is today my 70th